G'day everyone, I'm Ebony Bennett, Deputy Director at the Australia Institute, and welcome to Pole Position with Guardian Australia and Essential Media. Before we start, I'd like to acknowledge that I live and work on Ngunnawal and Ngambri country here in Canberra, and sovereignty was never ceded. It always was and always will be Aboriginal land, and I pay my respects to the traditional owners and to elders past and present. The days and times for these webinars do vary. This one in particular is fortnightly at this time on Tuesdays. Thanks so much for tuning in today and welcome. But some of our other webinars do change in terms of times. Tomorrow, for example, at 6 in the evening, we'll be talking to former UK Labor leader Ed Miliband along with Wayne Swan, and you can find the details for all our upcoming webinars on our website at australiainstitute.org.au. So thanks so much for tuning in today. Just before we get started, a couple of quick tips. If you hover over your Zoom menu, you should be able to see a Q&A box where you can type in questions for our panel. You should also be able to upvote questions from other people and make comments on those. Please keep things civil and on topic in the chat or we'll boot you out. And lastly, a reminder that this discussion is being recorded and we'll put a copy of it up on our YouTube channel. You can find that at australiainstitute.tv. So Pole Position is the show where we unpack all the big political issues and dive into the latest polling and political trends from the fortnightly Guardian Essential Report. And I'm delighted to welcome back our regular panellists, Katharine Murphy, Political Editor at Guardian Australia, Pete Lewis, Executive Director at Essential Media, and John Remington from Essential as well. Richard Dennis was due to join us, but unfortunately he couldn't make it at the last minute. So he sends his apologies, and I'm sure you'll see him again soon. And I guess just to kick us off, I was going to comment on the fact that the numbers in New South Wales are still really not looking very good, particularly the horrifying outbreak in Wilcannia that's affecting the Aboriginal community there. But the ACT, here where I am, despite its extended lockdown for a few more weeks, the numbers are looking much more promising here and elsewhere in the country. It seems like things are at least not exponentially growing. But it does mean that the national debate, I think, has really shifted more firmly into discussing what it means when we start getting up to those 70-80% vaccination thresholds. What does it look like when we start lifting restrictions? And what are some of the questions that are emerging around the assumptions in the Doherty modelling? I think we've started to see a bit of pushback around that. But it definitely seems to me, Katharine, that the debate has really shifted to looking ahead, as much as New South Wales is still really up the proverbial creek at the moment.
Yes, well, again, beautifully summarised, really. Yes, things aren't looking great in New South Wales. Hello to everybody in New South Wales who's tuned in, well, I'm thinking of you. All of my family lives in Sydney, so I know what it's like. And as you mentioned, Deb, it's also bad in regional New South Wales, including in Wilcannia, which is just sort of extraordinarily appalling, given that there was an early priority to vaccinate remote Indigenous communities, and clearly that has not happened to the extent that it should have happened. But you're right, things in the ACT where Eb and I are, the lockdown has been extended this morning, which I think we all expected, but the best news out of Andrew Barr's press conference was the R effective number is still below 1 in the ACT, which feels like winning in tough times. In Victoria too, the Premier has sort of conceded today and that they may not be able to eliminate, that numbers are high enough in Victoria at the moment where elimination may not be possible. But in that reboot, he's told the people of Melbourne and Victoria beyond that the objective will still be to get numbers as low as possible, because well, I suppose really if we could sort of distill this into one point, Eb, I think what if you listen to the leaders in the Federation on a daily basis at the moment, you'll be hearing quite a lot of division and quite a lot of debate around the specifics of Doherty and the other things that you flagged. But I think where there is a coalescence in the Federation, even though it's not that obvious, is that every leader in the country at the moment is that the sort of overwhelming and overriding objective in all jurisdictions is that the health systems not be overrun. That is the principal objective at this point that everybody is trying to manage. So even though we've got a lot of sound and fury, and that sound and fury is fascinating, as it has been throughout the pandemic, because what we're debating here is literally life and death. There's actually, I think, if you distill it down, that unanimity of purpose at this point, which is that you've got to keep infections low enough for the health system to withstand the peak of this particular epidemic curve, which hasn't arrived yet.
Yeah, it's a good observation. And Pete, we'll get to the polling in just a second, but it does strike me that Gladys's daily press conferences and the Prime Minister really pushing to look ahead, I think it kind of has shifted the debate. Do you think that's where we are now? Just looking ahead.
I think it's definitely where those two leaders want to take the debate. It's interesting watching Gladys's daily presser. She kind of comes in, talks very slowly about the large number of vaccines, whips through the record number of infections, and then brings up a special guest star to talk about something or other that's not about the spread of the virus. Now, there's clearly a need for leaders to instill hope. I think the missing piece, particularly for Morrison, is the gap between where we're going to be when we're all open and the steps to get there. And the research we've done in the field this week, and also some of the qual research we've been doing for various people over the last few weeks, suggests that people aren't quite ready just to do the jump of faith, even though it would be nice, wouldn't it? It'd be nice for us to be rushing to February next year and we're all vaccinated and living. The hard discussions are actually that, to Katharine's point, if this runs the way it looks like it's running, there are going to be more people being sick. You know, the kind of the midpoint prognosis, even in Doherty, is 1,500 deaths in the first 6 months. So people, unless the leaders open up about that as well and people start dealing with that, I think it creates a whole lot of long-term landmines just to get through the next news cycle. If it's all about hope and opening up without talking about the consequences of that, then, you know, you're not actually leading, you're just giving people what they want to hear in the moment.
Yeah, Katharine, I'll come back to you on that, just to stay with, I guess, the politics of it a little bit longer. Certainly as someone from the ACT watching those New South Wales press conferences, Pete's observation about kind of skating over the case numbers every day, Brad Hazzard kind of pushing back against that idea that we're starting to hear leaks from the healthcare services and hospitals that things are already really stressed there, and what's it going to look like, you know, with more cases. Do you think there's enough accountability there that people are willing to go with the New South Wales Premier, or are we still kind of in the thick of it and they are going to have to dealing with, you know, the fact that ambulances are ramping and nurses are saying, you know, there's not enough of them?
Yeah, well, look, in the National Cabinet conversations, Gladys Berejiklian is adamant with her colleagues that the New South Wales system will be able to absorb this run of infections. You know, she's been consistent on that point, and the leaders have been trying to basically fortify their health systems for the past 18 months. That's been an objective since the beginning of the pandemic. There are clearly a lot of people in the New South Wales health system, though, at the moment who are very worried about whether or not the hospital system can cope with the influx. The other sort of factor too that we sort of need to bear in mind is it's not only the pressure on the health system and the hospital system, there's also the fundamental assumption that sits under all of the Doherty work, which is that your testing, tracing, isolation, quarantine mechanisms work. Because if they don't work, then you're in a quite a different world in terms of managing the pandemic. So the health system the health system problem is at two thresholds. There's the public health element of that, and then there's also what happens in the hospital system. Now, I mean, I hope Gladys Berejiklian is right that the New South Wales health system, one of the best in the country, can absorb the peak of this epidemic curve. But Daniel Andrews' point this morning in his press conference was that we can't just sort of switch, because this has been around a bit in the messaging about the national reopening plan, that we need to move our mindsets from case numbers to numbers of hospitalisations. But what the Victorian Premier said this morning at his press conference is he's right, is that the two are linked. You can't actually disaggregate them. If case numbers are at a certain threshold, then the modelling will tell you that hospitalisations are at a certain threshold. So it's sort of not one or the other, if that makes sense. And in terms of tracking, isolating, quarantine, that side of the public health equation, there is a benefit in the system at the moment that's a bit hidden. And that's the benefit at the moment is that there's basically Delta states and Delta-free states just at the moment. And what's happening without a lot of attention being drawn to this is that there's triaging between the jurisdictions. People in WA and in other jurisdictions are helping contact tracers in the other states at this point in time. And that's basically helping maintaining that public health infrastructure. If there were to be a national outbreak where essentially the situation in New South Wales is replicated everywhere, then that triage that the national public health system is currently doing, all of that falls down because you don't have capacity anyway. I don't want to depress the pants off everybody, but that's my best situation report.
I'll go to the polling in just a second, but Hayden, if you could in the chat post a link to Richard's paper. I will just touch on a point that Katharine's made there. The Australia Institute earlier this week put out some analysis from our chief economist, Richard Dennis. He's really good at reading economic models, and he put his eye over some of the assumptions in the Doherty Institute modelling, and that issue of testing, tracing, isolating, quarantine, or TTIQ, he found a really interesting and concerning assumption in there that basically within the Doherty modelling, it does assume that even as case numbers kind of rocket, the TTIQ will be as effective as it was when Victoria was having 700 cases a day last year. But what we do know is that the more cases you get, you get a much bigger decline in the effectiveness of TTIQ. And it really is a huge public health measure that does help. So it is a bit of a flaw that we've spotted that people might be interested in reading a bit more about, because as Katharine said, perhaps that we can maintain that level of partial effectiveness even if other states are able to help. But once we are lifting restrictions, moving amongst states, will that capacity, we know it declines as the case numbers increase. Pete, we might go now to the actual, and now I've lost it again. There it is. Here we go to the results. And to kick us off, the federal government response. How is the federal government tracking here? Oh, Pete, you're on mute there.
So now I'm buying the drinks after I thought it was
exactly
on you.
Zoom
how are they tracking? They're tracking down. Net positive 39 is one above the lowest they've been, but it's sort of the number saying they're doing very well is down in 10% territory. Quite good 29. That's lower than you'd normally expect a primary vote. So they're heading south, and we've got some other numbers to suggest later. If you go to the next slide, this is the performance of the federal government in particular state jurisdictions. And again, as you can see, whereas this time, even in March this year, when we kind of all thought we were fancy free with a few isolated outbreaks and they were sort of enjoying the sorts of, support that would lead you to expect a fairly, orderly re-election sometime late this year. That's just history. So in New South Wales and Victoria in particular, federal government handling is down, but if we go to the next slide, you'll also see that state government handling is low. Little bit better in all states than the feds. So if it's a contest between the feds and the states still have the trust of people because they're closer to the ground, as we know. But New South Wales, 40% is the lowest it's been. And likewise in Victoria, 44% is the lowest it's been right through the pandemic in terms of satisfaction with the state government response. So what's going on there? I think there is just fatigue in the lockdown states. I'm up here in Sydney, and it is getting fairly relentless. And now we're getting a sense of what our friends in Melbourne experienced last year. They're experiencing it all over again. However, as we'll see in the later slides, while I think people are looking for hope, they're not quite latching on that it's going to be a magic wand. It just feels like a long, long road. This is interesting as well, state by state, the views towards lockdown restrictions. A third of Victorians reckon it's going too hard now, and a quarter of New South Welshans, with very few saying it's too weak. That's different to how it was in the early days for New South Wales. How good's WA there? But then again, you're going to the footy and you're going out for dinner there. So you wouldn't say there's insurrection. Those numbers, the majority of people accept that the lockdowns are necessary. They're either about right or not tough enough. So I think that the sense is now some sense of just acceptance that this is the way things are going to be. This is also an interesting graph where we're asking people how clear and easy to understand the lockdown restrictions are. And as you can see, much more clarity in Victoria, where the lockdown is more, like even with the numbers, the lockdown's harder in Victoria. New South Wales, depends your LGA, depends where you're working. And so there is still a degree of, when you add that up, a quarter of people not quite sure what's going on. That doesn't help the control of the spread at all.
Yeah.
So different stories in different states, and not a great story in general in New South Wales.
I think we should keep with COVID, Pete. So
Yep.
also
So
this week.
Slide. The next two are the ones that I think are really interesting this week.
Yeah.
So, Morrison launched his, as I call him, The Guardian, his new brand, Living with COVID, last week, and it got rave reviews, and he was getting slapped on the back by, all his supporters and the large sections of the press gallery, current company accepted. Katharine wrote an excellent piece on this in Saturday's Guardian. And I think there was an expectation that people would just cling on to hope. But what is really clear here is, giving people three choices, bring cases down as close to zero as possible. That's 44%. Live with a few cases, as long as there are very few hospitalizations and death, another 44%, and live with COVID, even if there are hospitalizations and death. The live with COVID but consequence, which is the end point of the sentence that the Prime Minister dare not utter, very low support. So the battleground really becomes that 44%. What does actually living with COVID with few hospitalizations and deaths actually look like? And going back to that midpoint in the kind of competent but not hitting it out of the park management, it's 1,500 deaths every 6 months. If you go to the next slide and we ask people how many deaths a year they would be acceptable to live with COVID, it's nowhere near that. It basically, you've got your 10% who would say they could countenance between 1,000 and 3,000, another 5% more than that. The vast majority of people say that is not an acceptable trade-off. Now, it's been an acceptable trade-off in other countries, but there is a real political challenge here. And yes, the deaths are amongst the unvaccinated, but there is also real concern when it's younger people. And it feeds into this idea of the 70 or 80% number as well, not including children. So there's, I think, a whole lot of hairs over what seems like that simple proposition that we can just, get over it, Australia, and live with COVID, which is kind of the libertarian Australian line. Onward into the fray, and it all feels really neat until you start, counting up the body bags.
Yeah, Katharine, that does seem to be kind of the hitch in the plans, because we have been so successful in managing it till this point. Our tolerance for high deaths, high case rates, high hospitalizations just really isn't there in the community as much as Morrison might hope that we've moved on from that point. And picking up Pete's point there, when we get to those 70 and 80% thresholds, it doesn't include a lot of kids. And, just because the population is at 80%, we know it's at a half, a third, or a tenth of that in some, for example, Aboriginal communities still. We still know that there's aged care workers that haven't been vaccinated. Like, it's all very well and good to just hit that point. But if people haven't even had the opportunity to get a vaccination because of the supply problems, and we're already starting to open up, do you think that poses a political problems as well as health ones?
Yeah, well, it's problematic. I think it's the sort of picture you've sketched there, Eb, is that in a way Australian leaders are prisoners of the expectations that they created for themselves during the first and second waves of the pandemic. If we were living in the UK or in America, we would have very different baseline expectations about what happens during a pandemic and what level of supports that governments deliver. I don't just mean in terms of cash, because obviously Biden has thrown an enormous amount of money at people, and he's also, basically rammed a vaccination program through that country, to quite a successful degree. Obviously, it's sort of it's tapping out now, but that's kind of where it's been. So look, if we lived elsewhere, we would have different expectations. Because we live in Australia, and because our leaders collectively were largely competent during the opening 18 months of the crisis, this is the lived experience that people process the pandemic through, what's happened previously. So now governments are asking us to process the pandemic through a different lens, which is called living with COVID, rather than the lives and livelihoods sort of period of pandemic management that we've come out of, that we're transiting out of. And it's unsurprising to me, because having this fantastic data series that we've managed to collect over the course of this pandemic over the last 18 months, what's been consistent in the Australian community is that there has been an enormously high tolerance for health measures that would not be accepted in other populations. We are obviously quite cautious and conservative, and that is sort of playing out in the figures that we see today, or see in this fortnight's poll. Obviously, there is this kind of dialogue that's happening even within individuals, and we're all conscious of it because we're all living in it, right? Like, part of us want to just get past this and are prepared to take our chances with, whatever sits on the other side of sitting in your house for weeks on end. But that's an impulse rather than a deeply held set of principles, because that's what the data tells us. There's an impulse there of frustration that when push comes to shove, when it's a matter of metrics and choices, Australians are picking the conservative choices. So here we are. Leaders have got a big job, obviously, to transit us, or to pick us up from one set of experiences and put us down in another. Now, obviously, we have to do that. We can't all stay in our second bedroom for the remainder of our life. Obviously, we do have to live with this virus. But the point is, when does it feel at least risk? I wouldn't say safe. I think the Prime Minister is using the word safe, and he shouldn't. it
He's
builds.
selling something else he can't deliver.
Well, exactly. It's sort of like, it's not possible, but we can certainly talk about least risk. We can talk about prudent steps. We can talk about risk management, and that's where we're at. So yeah, I'm not surprised by the results this fortnight. It seems to me to be the culmination of every other poll that we've looked at, Pete, for the last 18 months.
But what I reckon is interesting, Katharine, is when he did the change up last week, I thought this is significant, and he shifted the debate, and Gladys followed him, and they really had a crack at moving the debate on, and the people aren't ready to go there yet. And, you know, I want to be out as much as anyone. I would love to get to the vaccination rates and move through that process, but it's going to take more than slogans to get us there. And two observations. One is this silly attempt to wedge elbows supporting premiers in states where Delta hasn't run rampant, as if then he's not part of the Team Australia to open up. I think that was, you know, a cynical tell. The other thing is that I've noticed this year through the lockdowns, it feels there's less of a collective pastoral care going on between people. Last year, it felt, at least to me, that the community and the leaders were working hard to hold the community through a hard time, but it feels a lot less. That's maybe they're being overrun by the other challenges, but there feels to me to be a missing piece, which is if we are going to ask people to confront the risk of death, either through having vaccines where there's a small death rate, or going down a path where a small number of people who are vaccinated and young people on the projections will get sick and die, that takes a special sort of leadership to sort of get the nation working together to confront those things that we fear. And this guy just don't have it. And continually you see attempts to sort of almost sidestep the hard work that's going to be needed to get us into that point where we can confront what's really, really tough together. And I just, you know, maybe I'm, you know, wishing for a world where there are leaders that no longer exist, but there is a huge role to be filled there, which is beyond people getting up and reading out the daily stats.
Yeah, that's reminded me of a couple of things before we get back to the polling. So first of all, we've got nearly 770 people online with us today. I'm sure many of you are in lockdown, so thank you so much for joining us. Just looking back on what you've both said there, Katharine and Pete, it made me think of a couple of things. So Katharine, your point about our success and, you know, other countries have different tolerances did make me think. We spoke to Joseph Stiglitz last year, who was in New York at the height of their pandemic, and he talked about the fact that there was ambulances kind of every day outside of his apartment in New York, just going all hours of the day. And it was really awful for everyone who lived there, because they knew at the time that there was, you know, basically someone who was dying in every one of those ambulances, and how confronting for the city that was. And it also made me think of, we keep talking and focusing on how well the health system will cope, but really that's looking at ICUs and coping with COVID. And I've been talking to and know of friends in the past couple of weeks one who had to travel to Melbourne for an important surgery via Hobart before the ACT even had cases, and then even then her surgery nearly got cancelled at the last minute, something, you know, that had been on the books for kind of 6 months or more. We also haven't talked about the number of long COVID cases that the health system might have to cope with, you know, once cases go through the roof. There's all these other elements that come into play once it kind of the case numbers blow out. Even if we kind of decouple the deaths, there's still going to be high levels of hospitalizations that don't just affect COVID patients, but all kinds of people who need to access hospital and emergency services and ICU services. We might go back to the polling. Let's see where we were up to here. Biggest barriers to the COVID vaccine rollout. Pete, what do we see?
Well, you know, of course it's both, but as a duality, people aren't just talking about hesitancy. There's the supply issue as well, but they appear to be sort of two sides to the one coin on one level. And, you know, to their credit, the government appears to be getting the vaccines rolling out now. I think as it becomes more available to more people, there will be this other fault line developing, which will be the vaccinated and the unvaccinated, and whether the vaccinated take the view that they shouldn't have their freedoms, or whatever we call being able to go to the pub, impinged upon because others are not taking the opportunity that's before them to get vaccinated. I do think that over the coming weeks and months, you know, we've started to see it, but there will be that pressure on whether we call them vaccine passports or proof of vaccination being a price of entry. And that's where the Prime Minister has a real challenge on his right flank with, you know, noisy and well organised members of his own government who don't accept that as a price they're willing to pay. I think, you know, in key workplaces, in venues, once we start talking about different rights for people who are vaccinated, things will move to another level. And again, the test of leadership will be to unite rather than divide along those lines.
Yeah, Katharine, do you think the PM might be able to get Craig Kelly online if he was on board, if you talked about an ivermectin rollout, perhaps?
Oh God, let's not even think about it yet. Yeah, look, there's certainly there's been some part of the kind of layup, I guess, before where the Prime Minister was limbering us up to living with COVID. There has been this sort of growing tension in their base about prolonged lockdowns and restrictions that's kind of been, you know, building. You've seen it really play out over the last 4 or 6 weeks. And so obviously all political parties are responding to incentives in terms of their supporters and community sentiment. You know, as for Craig Kelly, well, the less said about Craig, the better, really.
That's right. But it does, I think, take us to that idea of, you know, passports, which seems quite sensible in one respect. You know, I want to travel around, I'm vaccinated, but then it does butt up against, as Pete said, that libertarian instinct of, no, I don't want to have to show papers anywhere I go to get around. Like, there is a genuine political thorny issue there for the
no, well, and a rights issue, and it's sort of you know, it's incredible, just sort of like tracking back to that point I was making a minute ago, you know, sort of how accommodating Australians have been with these you know, very, very significant restrictions on liberty through this pandemic. Now, I'm very grateful as a citizen and a member of community that Australians have been tolerant of these public health restrictions, because it's saved a lot of lives. But we are in very different territory to where we were pre-COVID in terms of the expectations of what people can do. And I think sort of libertarians would like to see the back of the whole sort of public health complex, call it that, right? Like I'm certain that that the sort of persistence of all of this sort of public health matrix is really triggering for some people, right? Like, that's really a whole lot of health bureaucrats sort of tut-tutting and telling us, you know, how to live and how to be safe and how to not kill other people. That's, a lot of people find that quite triggering. But and so yes, it is thorny. Obviously, these new, call them sort of restrictions, rewards, like that's where we're heading with vaccination passports and proof of, you know, vaccination before entry and all of this sort of stuff that we're going to be in terms of venues and in terms of mobility. Yeah, it's sort of extraordinary, really, that you've got to show papers in order to do very basic things that none of us would have thought twice about.
You used to have to get a shot when you went overseas. Like, the vaccinations, there have been compulsion around in the past.
Sure.
You know,
Yeah, sure. But this is that's absolutely right. But this is, we're talking domestic travel. We're talking about a certificate that turns up in your MyGov. I think I haven't seen mine yet, even though I'm double vaxxed. But it's like they're different. This is a different world.
Absolutely.
Just to run through the last couple of
Oh
slides.
yeah, the next one's important. The middle one here, people. So I wouldn't say 58 is strong support, not overwhelming support for the proposition. We shouldn't be easing any restrictions until a substantial proportion of children are fully vaccinated. This is obviously red hot amongst parents with kids, and the health advice says they're not going to be as sick as older people, but there are no guarantees, are there? And I do think of all the pieces of the Living with COVID rebrand, the fact that it's adults only at the moment is probably the biggest barrier for selling that particular slogan.
It's sort of, oh, sorry, Ed. Sorry.
No, you're right, you go.
It was just one quick point on the kids. I think it's really interesting actually, because certainly every parent I know is really worried about their kids, whether they're, as my kids are 22 and 19, or whether they're really tiny kids. Everybody's worried. And that's, everybody also understands the worries are proportionate. I mean, Pete made a very important point. The data tells us so far, touch wood, with this strain, that a lot more kids are getting sick because they're not vaccinated, but they're not necessarily ending up in hospital or in the sort of extremis of the health responses. So look, everyone's worried about their kids, but the group doing it toughest in lockdown, and I'm shouting out to any of you who are watching today in the lockdown states, are women who are bearing the brunt of remote learning and trying to sort of still function at work and all of that sort of stuff. So again, it's, I said a little while ago, it's sort of like you've got competing impulses even within individuals, right?
Yeah.
Really worried about your kids, but really worried about how you're going to manage, how you're going to get through lockdown with all of the responsibilities that you've got and obligations about caring and all of this sort of stuff. It's really the most extraordinary time.
It is. And we might finish here on these questions around Australia's involvement in the Afghanistan war. Obviously, that's all come to an absolutely inglorious end with a lot of civilian lives at risk, many thousands of people that were supposed to be evacuated that couldn't be. Pete, take us through some of these.
So this is a visual representation of a 5-point scale, and I'm going to lean on John in a second, because one of those greys will be the don't know. So while the numbers are under 50%, I wouldn't read that as being a rejection of the proposition. There's a lot of people already on the fence, but the one that interests me is that notion of the permanent visas to all Afghan nationals currently in Australia is only at 43. John, how many don't knows were in those?
We did have a don't know option in that scale. The lighter grey is sitting on the fence at the midpoint.
Okay.
The darker one is disagreeing with that statement.
Okay, so yeah. So there's, on one level, despite all the colour and movement, I suspect that with COVID, there's a lot of people in each of those that just don't have a view, or, as John says, are sitting on the fence. So whether it's actually even something as catastrophic as the collapse of a country where Australian troops have been involved for 20 years, it just hasn't created huge salience outside this news cycle, which is both, understandable and hugely concerning.
Legacy of kind of 20 years of demonising refugees might be at play there, Katharine?
Well, it's sort of one element of it, I think. But I just think at the moment it's like the principal thing that metric picks up is that COVID obliterates everything, obliterates all other conversations. People will have looked up, sure, over the last sort of week or so at key points in the terrible crisis that's unfolded in Kabul. They will have registered, obviously, that's happening, and terrible things have happened. But I reckon that's about as far as people's bandwidth stretches right at the moment.
I'll go now to questions. The first one is from Terence Hull. He says, The 70 and 80% figures are grasped by the government as important hurdles. The denominators they cling to are unrealistic, given that children can be contagious and also get very sick. Should we demand that the Prime Minister starts using the total population as the denominator for all those stats that he pulls out? Katharine, do you want to take that one?
Well, look, it's definitely an interesting argument. Doherty sort of advises that it's in a way, sorry, I'll just back up, because in a way there's sort of been a bit of a false debate about all of this. Obviously, vaccinating small kids, kids under 12, that's a whole other sort of like zone of the pandemic that no one's sort of managed yet. No one's got there yet. But in terms of what we're going to do for teenagers, once the additional vaccine supply turns up in the country, touch wood, let's hope it does, basically this vaccination program, in terms of stretching towards those targets, I think a lot of teenagers are going to be vaccinated concurrently, even though there's a quite reasonable debate about whether or not kids are in or out of the national target. I think that's a totally legit debate that we have to have, because we have to understand the sort of the role of kids in the pandemic in two ways. One, obviously we have to protect them, but two, we have to understand that they're peak transmitters, as the questioner said, right? So look, we can have that discussion, but I think in reality, I think in practice, there is really going to be a concurrent program here over the next, once the supply turns up. Obviously, it's impossible at the moment. And the Prime Minister was very silly to say, whenever that was, a week or 10 days ago, I can barely keep up, that, you know, sort of teenagers were all of a sudden in the rollout when there was no actual vaccine to give them. I mean, that was an incredibly unhelpful thing to say, and caused a whole lot of stress for the premiers. But I just think, when we look, who knows, you know, how things will really look in November and December, right? This is a really challenging period we're living through now, but I reckon it's not beyond the bounds of possibility that we get to November and December and we look back at this and we think, oh yeah, actually a lot of teenagers got vaccinated at the same time.
Can I just say one other thing for those that are interested in, which I think we all are at the moment? Michael Lewis has put out a fantastic book called The Premonition, which really talks about the creation and then destruction of the pandemic plan that George W. Bush initially sparked back in 2003. But one of the key changes in policy was to recognise that schools were the ultimate super spreading environment, because kids can't exercise social distancing the way adults do. And so the other part of this, and it kind of comes in the noise, but it's more about the kids getting sick, but that's been identified by the public health experts as the most effective way of spreading a virus. So again, there's an argument there for, to the degree it's safe, vaccination, or finding new ways of thinking about how school classrooms are going to operate. The other thing that we're seeing from other parts of the world is the need for the ventilation systems to be overhauled, and that's going to be hugely expensive and complex as well. I suspect, again, it's going to be something that we're not going to move on until the problem's right presented in front of us, rather than having it planned out in advance. Yeah,
because somehow upgrading schools isn't infrastructure or nation building in the same
way. It's a waste of money, as the GFC showed.
Katharine, the next question I might throw to you is from Mark Berg. He says, how do you view Frydenberg's threats to cut off wage supplementation if states don't cease lockdowns and open borders?
Sorry to laugh. That's not the appropriate response. I think. Look, obviously, the Treasurer wanted to sort of move this conversation, this seminar, into a mind-focusing moment, right? Which was when he said to the premiers, although what he said is actually very hedged if you read what he says, but the message he wanted to send was, don't imagine that there's unlimited fiscal support if you guys don't open when we think you should be open, right? So it was a bit of a mind-focusing moment. The Finance Minister, Simon Birmingham, actually has, and he's the guy who says yes or no about the money, he's the finance minister, struck a very different tone about that only a couple of days after Frydenberg had gone out with his mind-focusing mantras. He basically said to people, look, obviously we'll engage brains about all of these propositions, we'll look at what's happening and we'll respond accordingly, right? Which is obviously a completely different message. I think Andrew Barr cheekily in the ACT, and you guys, if you're outside the territory, probably wouldn't have seen his remarks, but he sort of cut to the quick of the politics of this several days ago, in which he pointed out that this was great as bluffs go, but anybody who believes that the Commonwealth is going to withdraw fiscal support in the 6 months before it needs to face the people at an election is living on another planet. So I think that best summarises the debate.
Pete, this next one's for you. It's from Sharani Demel, and they ask, there's an Ausgov poll that seems totally opposite to the Guardian Essential poll today. I wonder if that's what's in the Australian today. Do you want to kind of talk about that?
Yeah, obviously, and John can join me in on this, the YouGov / News poll, in terms of their votes and their general mood, is pretty consistent with Essential, but they've asked different questions. So we targeted our questions at testing the proposition on what terms would people be prepared to live with COVID. I think the Oz asked a number of questions that were designed to make the case that people did want to live with COVID. So if you look at some of these questions, there's a focus on knowing people whose mental health has suffered during the lockdowns. That's not dissimilar to what we've asked in the past, and I don't think the numbers are dissimilar either, John. And so I just think, we like to think that we design questions out of genuine curiosity, and Katharine, John and I talk every fortnight about the questions that are going in the field, but obviously other people construct their questions to shine light on their reality as well.
Yeah, and
is that diplomatic enough?
I encourage everyone to have a look at what's being said in those polls, and certainly do for us as well. The YouGov are very, as we are, transparent about who we speak to, how many people we speak to, how the questions are asked, when they're spoken to, and all of those details are available from the Oz article, which we read through. And as Katharine knows, there is some interpretation with taking what we're publishing and putting that into an article as well. So I would encourage people to also read past the headlines and look at the data and to come to your own interpretations about what that's showing as well.
And of course, there was a third poll last week, the Resolve for Fairfax, where they'd picked up a sharp decline in Labor's primary vote, and that was read as a vindication of the living with COVID strategy. So there is a danger, and again, Katharine and I talk about this every time we get a poll, in overreading movements within the margin of error, but also just being prepared to challenge your own assumptions rather than trying to reinforce your own worldview. I don't know if you want to add anything to that, Katharine. You're the one that has to write about these things.
Well, obviously, John makes a very good point about interpretation. Obviously, I write up the poll most fortnights, but that's my best interpretation of data that I follow closely. But we obviously the essential poll questions and data appears on the website every fortnight. People should go and have a look at it themselves and form their own conclusions about what they think is interesting about the data and what it says. It's just obvious, really, that you can sort of it's not so much manipulating response rates. It's not sinister like that. I mean, it's just, if you ask a question in different ways, you'll get different responses. So that explains sort of disparities that on the face of it look incomprehensible. I think it's perfectly comprehensible, largely just reflects a combination of how questions are framed and then a lens by which that information is interpreted.
The next question is from David Morrison. He says, has the discussion about the hospital system being able to cope considered the ability of staff to carry on under this ongoing load? And he says, for example, in Mississippi, 2,000 nurses have resigned since January this year. Katharine, do you want to talk a little bit about that?
Yeah, well, it's sort of, look, I don't know to what extent that it's examined that, well, I don't know, call it burnout question, but obviously people working in the health system are doing the most extraordinary job. I mean, I don't know how many people tuned into Gladys Berejiklian's press conference this morning, but if you did, you would have seen her accompanied by an intensive care nurse who explained in very simple and stark language what it's like to nurse patients, COVID patients in intensive care at the moment, including, you know, having to flip people to ventilate them and doing that in several layers of PPE. I'm the daughter of a nurse and a former intensive care nurse. These people are heroes and legends. And look, I don't know whether or not the hospital planning has taken that particular risk into account, but I'd be surprised if somebody hadn't thought about it, because you know, what these people in the health system are going to live through over the next couple of months, sort of, you know, they're just extraordinary, really.
And there's also the impact of infections when a workforce is wiped out, and where's the reserve workforce? And traditionally, we've relied on a lot of 457 workers to come in and fill the breach, and that's not an option at the moment either. So there's a whole lot of issues.
Well, and vaccinating aged care workers. Brad Hazard this morning in New South Wales said to Scott Morrison, you know, your grand plan to get all of us to compulsorily vaccinate aged care workers using state directions, that's not going to work, mate. So what's plan B?
Yeah. And it does, well, I won't get into that. Anyway, next question. Here's one for you, Katharine. Latest polling suggests 2/3 of Australians support greater action on climate change. What will it take for the federal government to
Oh, God, you guys, you want to drive me nuts, don't you? No. Okay, well, what will it take? Okay, well, at the risk of a shameless self-promoting plug, if you want to feel slightly optimistic, and I would be heavy on the slight rather than the optimism, have a listen to a podcast that I did with the Treasurer, Josh Frydenberg, that dropped on Saturday. That's in my pod series, which you can easily track down. If you just Google my name and podcast, you'll find it. The Treasurer referred to ongoing discussions within the government in terms of the preparation for the Glasgow COP26, which is coming up in November. Possibly the Treasurer said encouraging things or sent encouraging hints about how those conversations were going, because he feared for his life, because he was in close quarters with me in the pod cave at the time, and perhaps that was the strongest line he could give me to get out alive. But anyway, he did say, look, we're making progress, we're bumping along, we're making progress. We understand it's important. We understand that global capital has now made a choice. We understand that we're in a trading environment that's essentially net zero. They do get it. I think it's taken a long time, but they get it. Whether or not they can deliver anything that isn't risible, well, let's see.
Probably our last or second last question is from Linda Tulberg. She says, will the looming crisis in Indigenous populations due to the failures to meet the 1A and 1B targets have a material effect on the poll numbers? I mean, forget about the poll numbers. How are vaccination rates looking at the moment for Indigenous communities across the country, Katharine?
Well, the last figures I saw, and we had some really detailed numbers that an informant gave us from dealing with Indigenous vaccination rates across population centres, which, if you're interested in this, you'll be able to track down if you have a look at the Guardian website and you look for stories by Lorena Allam, who's our Indigenous Affairs editor, she's worked with our data guy, Nick Evershed, to sort of crunch these numbers. The picture is not good. The picture is, sort of the vaccination rates in Indigenous communities. The last figures I saw were running about half of the general population. And obviously the general population in Australia, vaccination rates are still low. They're climbing rapidly because we've moved from a stroll out to an actual rollout now, thank God, and that will continue, I hope, once a new supply lands in the country. But look, this is appalling. I said that at the beginning about Wilcannia. It's the only word I've got for what has happened. Government's public health officials, they knew the risks, they articulated them early. Now, obviously, vaccinating people in remote areas is a complicated effort logistically, and also you've got to basically persuade the population to be vaccinated in the same way that persuasion effort has gone on elsewhere. I think the discussion about the efficacy and risks associated with AstraZeneca obviously hasn't helped that. But yeah, it's just appalling what's happened. And the thing I fear is that there's this sort of grey zone between Commonwealth and state responsibility where this sits, where I think state governments in the middle of major outbreaks are prepared to duck shove this back onto the Commonwealth and wash their hands of it, in essence. Just say, look, this is a Commonwealth responsibility. We've got enough to worry about. Now, that's true and fair on the face of it. But in order to get these vulnerable populations vaccinated, we need the tiers of governments to be working collaboratively and quickly, because it's just unconscionable what's happened.
And as to your point about Brad Hazzard and aged care earlier, like, what is the plan B here? We've had, all this time and we had them, announced as priorities, and it turns out that was more or less just an announcement. And I heard, was it Linda Burney talking about the success of kind of going door to door in these communities? But like, why am I hearing that from Linda Burney and not from Greg Hunt? Or, is there any sense that there is actual detailed plans about how to do this rollout for vulnerable communities?
Well, it's sort of, the concern I have is what I've articulated, that there sort of is this grey zone risk where the jurisdictions are basically doing that.
Yeah.
And that's the worst of all worlds at the moment. People who work in Indigenous public health understand that there are different modes and methodologies you use in order to deliver public health to those populations, both in urban areas and in regional areas. Look, I know that a lot of people at the state level have been raising the alarm over the vulnerability of Indigenous populations for some months. And they need to crack on.
And just to round that out, Eb, back to, I think the Indigenous issue stands alongside people with disability and people in poverty. As long as we're talking this big helicopter branded view of 70 to 80 and then we're living with COVID, we don't look at what the consequences of those decisions are. Really important role for media to bring that to attention, and really important for all of us as citizens not to just be accepting the top level numbers and the top level slogans, but actually say, so what does this mean? So hopefully that's the one thing that came out of the research we did this week, that I don't think the public's waving this through as simplistically as maybe some of our leaders would hope.
Yeah, and certainly something that I've noticed the New South Wales Chief Health Officer bring up time and again is, equity. And we want to see huge and high, above 90% kind of getting to 100% levels for these vulnerable communities, and not just, 80% of the whole population is good enough. So, obviously if you're a public health professional, you've got a strong interest there. But I thought that was really good to hear, straight from the chief health officer this week. Look, thank you. That's all we've got time for this week, everyone. Thank you so much. A reminder, we'll be talking to former UK Labor leader Ed Miliband and Wayne Swan tomorrow night about Ed Miliband's new book, Go Big. It's all about positive solutions for big problems. So if you're feeling a bit down in the dumps, that'll be a nice one to listen to. And next week, we're hoping to talk to Change the Record, as well as some Aboriginal and Torres Strait Islander people about raising the age and getting kids out of prison. And I want to thank everyone for coming along today, particularly those of you in lockdown. We really appreciate you coming along. Thanks to Katharine Murphy, Pete Lewis, and John Remington. And as always, I'm sorry I didn't get to all of your great questions. If you need any other information, you can head on over to either Guardian for the Guardian Essential Poll or to australiainstitute.org.au to find our upcoming webinars and all our other research, including Richard's paper on the assumptions in the Doherty Institute modelling and TTIQ. Thanks so much for joining us today. Stay safe out there. I hope you're not all losing it in lockdown. Take care of yourselves. Get vaccinated as soon as you can, and we'll see you in a fortnight. Thanks, everyone.
The bottom 20% get nothing. They're really unfair tax cuts.
People want to see much stronger action from the government when it comes to climate change.
It's no coincidence that we have a wages crisis in Australia.
Transitioning to net zero emissions, it doesn't seem like there's much room for gas.